Hi, my name is Candida Nacion, and I will be reading Professional English in Use of Medicine, chapters 5 to 13, and I'm going to be reading the exercises of these chapters. First, we have chapter 5, which is Medical Practitioners Part 1. The first exercise says, write sentences to describe the work of the specialist in each branch of medicine. Look at the opposite to help you. Number 1, dermatology. Number 2, rheumatology. Number 3, traumatology. 4, pediatrics. And 5, obstetrics. A dermatologist specializes in the diseases of the skin. A rheumatologist specializes in inflammatory and autoimmune diseases. A traumatologist specializes in trauma and severe physical injuries. A pediatrician specializes in babies and kids' diseases. 5.2. Complete the table with words from A, B, and C opposite and related forms. Put a stress mark in front of the stressed syllable in each word. The first one has been done for you. Verb, specialize. Noun, noun of the person, specialist. Noun of the activity of or thing, specialty. Verb, practice. Noun, practitioner. Noun of activity or thing, practice. Verb, consult. Noun of the person, consultant. Noun of activity, consultation. Verb, assist. Noun of the person, assistant. Noun of activity, assistance. Verb, graduate. Noun, graduate. Noun of activity, graduation. Verb, qualify. Noun of activity, qualification. 5.3. Find prepositions in C opposite that can be used to make word combinations with the words in the box. Then use the correct forms of the words to complete the sentences. In the box, we have the words good, interested, specialize, and work. Number 1. A pathologist specializes diagnosing disease through examining cells and tissues. B2. A pediatrician must enjoy working with children. 3. An oncologist is interested in the diagnosis and treatment of cancer. 4. A psychiatrist must be good at counseling. 5. A neurosurgeon must be good with her hands. 5.4. Make word combinations using a word from each box. 2 words can be used twice. Look at B and C opposite to help you. We have the word consultant, and I matched it with consulting rooms, general practitioner, group with practice, health center, internal medicine, and surgical specialties. Next, we have chapter 6, Medical Practitioners Part 2. Exercise 6.1. Make word combinations using a word from each box. Look at A, B, and C opposite to help you. We have the words associate. I used it with specialist, associate specialist, house officer, on call, provisional, radio pager, ward diagnosis, and provisional round. 6.2. Make The descriptions 1 to 5 with the match the descriptions 1 to 5 with the job titles A to E, sorry. Look at B and C opposite to help you. Number 1. Dr. Graham has been a pediatrician for 8 years and is responsible for treating the children admitted to Ward 60. I matched it with letter D. No, with letter C, he is a consultant. Number 2. Dr. Stewart has just started the second year of her foundation program, and I matched it with letter D, which is an SHO. Number 3. Dr. Singh has started his training as a surgeon. Is letter A, a specialist registrar. Number 4. Dr. Phillips has just graduated and is working in a large hospital in Birmingham. That's the letter E. He is a PRHO or house officer. And number 5, Dr. Miller is in charge of the medical staff in the Birmingham hospital. It's letter B. She's a medical director. 6.3. Are the following statements true or false? Find reasons for your answers in A, B, and C opposite. Number 1, a medical graduate becomes registered 2 years after graduation. That is true. The system of training doctors in Britain is called the Foundation Program is also true. The name senior house officer is no longer used in Britain. That is false. 4. The consultant is usually the first doctor to see new patients. That's false. 5. When working in shifts, all doctors take turns to be on call. That is true. 6.4. Complete the test of a PRHO describing her job. When I get to the ward, the first thing I do is talk to the house officer who was on duty during the last shift to find out if there have been any new admissions. Then I generally see the charge nurse. He tells me if there is anything that needs to be done urgently, such as intravenous lines to put up or take down. Later in the morning, I clerk any new patients, which basically involves taking a history. On Tuesday and Friday morning, the consultant does her ward rounds, and I have to make sure I'm completely up to date on her patients. After that, there are usually lots of things to do, like writing up requests from blood tests and so on. In the afternoon, I have to prepare for any patients who are to be discharged the next day. They're usually happy to be going home. And then, of course, there are the lectures and tutorials in the foundation program on Monday and Wednesday. Chapter 7, Nurses. 7.1. Complete the sentences. Look at A, B, and C opposite to help. Number 1. Someone who specializes in delivering babies is a midwife. Someone who is qualified to assist nurses is a clinical support worker. Someone who is not qualified but is able to assist nurses is a nursing auxiliary. A nurse who has qualified is a staff nurse. A nurse who specializes in health promotion is a health visitor. A nurse who looks after a ward is a charge nurse. A nurse who works in the community is a district nurse. Someone who answers the ward telephone is a ward clerk. 7.2. Make word combinations using a word or phrase from each box. Look at the opposite to help you. I make the word combinations carry out a procedure, give an injection, change dressing, check the temperature, and remove sutures. 7.3. Complete the sentences with the correct grammatical form of perform. An esophageal brain Scan is painless and easy to perform. Biopsy of the pancreas was performed last March. If the patient's condition deteriorates, a laparotomy should be performed. If a diagnosis of meningitis is suspected, a lumbar puncture must be performed. Last year, we performed a randomized double blind group study. 7.4. Complete the sentences with the correct grammatical form of carry out. Number 1. I now intend to carry out a larger study. Number 2. Unfortunately, few properly controlled trials can be carried out so far. Number 3. A number of studies were carried out recently to look at this question. Number 4. A right hemicolectomy was carried out and the patient made a full recovery. Number 5. This procedure can be carried out in the emergency department. Chapter 8. Allied Health Professionals. 8.1. Make word combinations using a word from each box. Look at A, B, C, D, and D opposite to help you. I made the word combinations occupational therapist, social worker, intraocular pressure, ambulance technician, artificial limb, club foot, contact lens, health professional. 8.2. Which allied health professional could be best help the following people? Look at B, C, and D opposite to help you. Number 1. A young unmarried woman who has just had a baby. The allied professional in this case is a social worker. Number 2. A woman who is having difficulty using her right arm following a fracture. She needs a physiotherapist. Number 3. Someone who needs glasses needs an optician. Number 4. An elderly woman who has had a below knee amputation needs a prosthetist. Number 5. A man whose wife has Alzheimer's disease needs an occupational therapist. And number 6. With a fungal infection of his feet, a man with a fungal infection on his feet needs a podiatrist. 8.3. Complete the text. Look at A and C opposites to help. A prosthetist works with patients of all ages as a member of a clinical team based at a large hospital. The patients may need a prosthesis as a result of an accident or an amputation. Following a disease such as diabetes, alternatively, they might have been born without a limb. Orthotists work alongside doctors, nurses, physiotherapists, and occupational therapists to give the people under their care the best possible treatment. Their main aim is to enable the patient to lead a normal life at work and leisure. An orthotist often works in a clinic as part of an outpatient service and also visits other centers to provide a service for people with special needs. They deal with people of all ages. For instance, children who have cerebral palsy may require splints to help them walk, and many older people need special shoes to correct clubfoot. If damaged, any part of the human skeleton may require some form of orthodosis. The orthodosis may be needed to reposition the body or to relieve pain. Chapter 9. Hospitals. 9.1. Complete the table with words from A, B, and C opposite. Put a stress mark in front of the stress syllable in each word. The first one has been done for you. Verb, admit. Noun, admission. Verb, assess. Noun, assessment. Verb, discharge. Noun, discharge. Verb, operate. Noun, operation. Verb, refer. Noun, referral. Verb, treat. Noun, treatment. 9.2. Make word combinations using a word from each box. Look at C opposite to help you. I made the word combinations acutely ill, waiting list, assessment unit, referral letter, and on duty. 9.3. Which hospital departments would be the most appropriate for the following patients? Look at A, B, and C opposite to help you. Number 1. A woman in a diabetic coma. She needs to go to the accident and emergency department. Number 2. A patient who has just had a radical prostatectomy needs to go to the surgical high dependency unit. 3. A patient who is to have a skin lesion removed to the day surgery unit. Number 4. A man with a foreign body in his eye, the outpatient department. 5. A woman with a threatened abortion, the gynecology emergency. 9.4. Complete the extract from an information leaflet for patients. Look at A, B, and C opposite to help you. Information for outpatients. When you arrive at the OPD, please tell the receptionist who will welcome you, check your details, and direct you to the waiting area. The length of your visit will depend on the treatment you're going to have. You may need to have some tests, such as an x ray, which could mean going to another department. Or you may be referred to other professionals, such as a physiotherapist or a dietitian. You may need to revisit the clinic. If staff at the clinic want to see you again, another appointment will be arranged for you. If you need to be admitted to hospital for more treatment, either as an inpatient or for emergency surgery, you will be told when this is likely to happen. If you do not need further treatment, you will be discharged to your GP's care. Chapter 10. Primary Care. 10.1. Complete the sentences. Look at A opposite to help you. Number 1. Children over 60s and people with some chronic diseases do not have to pay prescription charge in the UK. Number 2. Patients with mobility problems may be unable to go out. They are housebound. Number 3. The average GP appointment is 10 minutes long. Number 4. The answer is a locum GP is someone who takes the place of a staff member who is on a leave. Number 5. Care outside working hours is known as out of hours treatment. 10.2. Make word combinations using a word or phrase from each box. One word can be used twice. Look at A and B opposite to help you. I made the word combinations change dressings, make appointments, perform minor surgery, refer a patient, supervise staff, take messages, and run a clinic. 10.3. Which member of a practice team will be responsible for each of the following? Number 1, running a clinic for pregnant women, that will be a midwife. Number 2, teaching a patient how to strengthen his broken leg. This is the work of a physiotherapist. Number 3, letting the GP know that a patient can come to her appointment. This is the work of a receptionist. 4, running a clinic for people who want to lose weight. These are the GPs. 5. Visiting a patient who has just returned home after a hernia operation, a district nurse. 6. Carry out checkups on children in a poor neighborhood, the health visitor. Number 7. Organizing cover for an absent doctor, the primary care trust. 10.4. Complete the diary for Dr. Stewart's afternoon. Look at A and C opposite to help you. 1 to 2 p.m. Practice team meeting over sandwich lunch. 2 p.m. to 4 p.m. afternoon surgery. 12 10-minute appointments. 4 to 4:20 p.m. coffee break. 4:20 to 5 p.m., check with reception for messages, deal with home visit requests, and repeat prescription requests. 5 to 6 p.m., paperwork, referrals to secondary care, tasks, telephone calls to patients, private medical examinations. 6 p.m., phones switch to out of service. Chapter 11, Medical Education Part 1. 11.1. Match these activities to the stages of medical education in the UK given in A opposite. Number 1, dissecting cadavers. This is it's stage 1. 2, keeping a log of surgical procedures observed and performed. This is in stage 3. Number 3, working for 4 months in accident and emergency to experience this specialty. This is in its stage 2. 4, taking a 4-week attachment in obstetrics and gynecology. This is in stage 3. 4, taking an online course on recent developments in cardiovascular disease. This is in stage 4. Complete the sentences. Look at B and C opposite to help you. Number 1. Just before their final year, students have the chance to take an elective in a hospital of their choice anywhere in the world. Number 2. The word that I used was problem-based learning contrasts with an approach where each subject is taught separately. 3. These days' lectures are often interactive with regular opportunities for the students to ask questions. 4. In clinical skills, students learn how to treat and manage patients. Number 5. Student selected modules can be a topic from outside medicine, such as a foreign language. Number 6. Dissection of cadavers is an important part of the anatomy component. Number 7. The medical degree course at the University of Edinburgh is one of the oldest in the UK. Number 8. She's a consultant at the Royal, one of the leading pediatric heart specialists in the country. Number 9. The Royal College of Surgeons in Edinburgh dates from 1505. Number 10. We have a seminar each week where we discuss topics in a small group with our lecturer. 11.3. Match each of these activities to one of the components of the undergraduate course. Number 1. Julia spent 6 weeks working in a small hospital in the Himalayas. She is in a student selected module. 2. A group of students discuss together the possible reasons for abdominal pain after meals in an obese 44-year-old male. The activity is problem-based learning. Number 3. A small group of students trace the pulmonary artery in a cadaver. These are core seminars. 4. Otto spends a month working in the pediatric ward of the local hospital. This is a clinical attachment. 5. Anne learns how to take blood from an elderly patient. This is a vocational studies and clinical skills. 6. Juma chooses to study travel medicine in his 4th year. This activity is student selected module. Chapter 12. Exercise 12.1. Complete the phrases with verbs from the box. 2 phrases can be completed in 2 different ways. Look at A and B opposite to help. In the box, we have the letters assess, deliver, demonstrate, provide, supervise, and take. Number 1. Demonstrate a competence or how to do something. Number 2. Assess a trainee by ensuring she successfully completes her training. Number 3. Demonstrate a course We can also use provide a course or a training program as a teacher. Number four, take a course or a training program as a student. Number five, supervise progress or competence. 12.2. Match the two parts of the sentences. Look at A, B, and C opposite to help you. Number one, an FY1 doctor is in the first year of the foundation program. Number two, a demonstrator is an anatomy teacher who teaches dissection. Number three, a clinical trainer is a consultant who provides training during periods of direct clinical care. Number four, a supervisor is a consultant responsible for the training program of a trainee. Number five, a medical school is a part of the university responsible for medical education. Number six, a placement is a period spent as a trainee in a hospital or in a general practice. Number seven, a college is a body of specialists responsible for delivering and assessing training in their specialty. Number eight, a fellow is a specialist who has reached the highest level in their specialty. 12.3. Write in full the qualifications of the doctors and surgeons. Look at C opposite to help you. Number one, Mr. A.H. Young Husband, MBCHB, FRSCS, FRSCSI, means Bachelor of Medicine, Fellow of the Royal College of Surgeons, Fellow of the Royal College of Surgeons of Ireland. Number two, Dr. C. Doyle, MB, MBD, SCIDM, MRSCP, means Doctor of Medicine, member of the Royal College of Physicians. Number three, Mrs. E. Inglis, MBBS FRSCS, Bachelor of Surgery, Fellow of the Royal College of Surgeons of England. Number four, Dr. E. Merriweather, BM MD FRSCP, FRCP, Bachelor of Medicine, Doctor of Medicine, Fellow of the Royal College of Physicians. Chapter 13, The Overseas Doctor. Exercise 13.1. What kind of registration might these doctors obtain? Look at A opposite to help you. Number one, a newly qualified Spanish doctor. He or she will get a provisional registration. Number two, a newly qualified Nigerian doctor. He will have or she will have a limited registration. Three, a doctor who has successfully completed the first foundation year. He or she gets a full registration. Number four, an SHO who has successfully completed the foundation program and gained a certificate of completion of training after several specialist registrar posts. He or she gets a specialist registration. 13.2. Write the abbreviations in words. Number one, any doctor who wants to work in the UK must register with the GMC. GMC means General Medical Council. Number two, some overseas doctors must pass the PLAB test before they can register. This means Professional and Linguistic Assessments Board. Number three, part two of the test consists of an OSCE, which means Objective Structured Clinical Examination. Four, in any emergency, remember the ABC protocol, which means airways, breathing, circulation. Number five, before you can obtain a specialist registration, you must have a CCT, which means a certificate of completion of training. 13.3. Complete the text. My name is Musa and I come from Yemen. I came to the UK about 2 years ago after graduating. Because Yemen is outside the EEA, I could only obtain limited registration with the GMC at first. It was very difficult for me to obtain a place on a foundation program. Although I speak good English, I had to take the PLAB test to show that I could work safely in the UK. If I had to give some advice to other candidates, it would be that at counseling examinations, you shouldn't simply memorize a set of phrases. It's better to really think about what you're saying to the actor and get the intonation right. After completing my year's clinical training, I was able to obtain full registration, but I found it difficult to get an SHO post in my chosen specialty, pediatrics, as hospitals now have to demonstrate there isn't a suitable candidate from the EEA. Once I've completed my second foundation year, I should obtain a GP register, which will allow me to proceed to a specialist registration with the GMC, an important step on the road to becoming a pediatric consultant.